Hi, it's Dr. Morazi with Minutes for Moms, here to give you more practical pediatric advice. This will be our third in our series of 5 videos in regards to your 2-month-old baby. Today we are going to talk about infant feeding, 2-month-old feeding. Really by now things are established and things really should be fairly smooth. At that 2-month checkup, I definitely want you to pay attention to that growth curve. That growth curve gives you so much reinforcement and is actually a joy to watch to see that baby get bigger and bigger and bigger. I'm going to give you a couple pointers with both formula as well as breastfeeding. From a formula standpoint, where your baby should be at would typically between 3 to 4, maybe a little bit more ounces every feeding, every 3 to 4 hours, and they should be efficient and polishing that bottle off probably within 10 minutes, really without any problems at all. One thing that I have people be careful with is that changing formulas, that formula song and dance can be very, very frustrating because there's so many formulas out there. There's so many things to choose from, and there's not much difference between them. So usually I have different groupings that I will work with several ones under each kind of grouping. So by all means, if you feel like you need to switch that formula, please contact your primary care provider and they will give you your guidance on that. But other than that, that formula should be fairly straightforward. From a breastfeeding standpoint, same things. Things should be straightforward by then. Your nipples should no longer be sore. Things should be established. Your milk should be in, and the baby should be efficient. Really, from a feeding standpoint, most of your milk should be out within the first 10 to 15 minutes if the baby's doing a good job nursing, because if you were to pump, most of your milk is out in that 10 to 15 minutes. So the same thing is going to be going if you're putting the baby to the breast. So that is kind of very nice. One thing that I do talk about at that 2-month visit is working on a milk supply. If you need to have some storage of milk because you're going back to work, then this is the time that you start it. Anywhere between 4 to 8 weeks is when you can establish a specific time that you're going to pump. Kind of when my babies were little, what happened was mornings were the best for me. So if the baby typically fed at like 8 o'clock and then 11, what I would do is at that 9:30 time, so halfway in between, that's when I would do my pumping. And every single day I would do that pumping. And with that, your milk supply becomes established, that you have that extra feeding then. And that extra feeding then is pumped and thrown in the freezer. And that is how you work on that supply. So some people work on a supply so they can stop nursing and have something there for the next couple months. Others work on that supply just to get them through that next day. What you want to remember is if you go back to work, what you're pumping today, a lot of times the baby gets tomorrow, so you don't have to work on a ton of supply before you go back to work. So same thing, if you have any issues with that, by all means, you're going to want to contact your primary care provider for that. So hopefully that gave you some guidance with that 2-month-old feeding. Once again, this is Dr. Morazi with Minutes for Moms. If this is your first time coming to my channel, please give me a like, subscribe. And if you have any comments for any future videos, please leave those in the comment section. And now you know what I know. So until next time, bye. Thanks.